I'm Amy Giaquinto and I am Mama Fix It. And on today's episode, I'm going to talk about what happens when Mama Fix It is a little broken. Actually, I want to tell you my whole story and I want to talk about how to best recover from any surgery. In my case, it was cervical spine surgery. So let me tell you the story of what happened to Mama Fix It. I have undifferentiated connective tissue disease, fibromyalgia, scoliosis, and hypermobility. What does all that mean? Those are just big words to me. Basically, I have floppy joints that do whatever, and my back is really crooked. So, but not crooked enough to require surgery back when I was young, just crooked enough to maybe cause some extra pressure between all of the joints in my spine and the rest of my body. So, with that, I am also blessed with being very athletic. Like at my age, I can still do the splits. I can jump on the trampoline and do flips. I can kick as high as my head in karate, actually over my head in karate. I've got all of this at natural athletic ability, but I have a body that thinks it's 110 years old. So you put those two things together and something is bound to give, right? I had 4 months left until I was going to test for my black belt with my daughter. And then one night I came home. I did what I do normally. I was tired. I put the kids to bed with my husband and I crashed hard. And I was sleeping so soundly. But maybe I was really... And suddenly I woke up and I had shooting pain, intense pain from my neck through my scapula, my shoulder blade, through my shoulder, through my chest, all the way down my left arm. And my fingers were starting to go numb. And I was like, oh, this is bad. This is really bad. I was in so much pain that I woke my husband up. I think it was really early in the morning. And I was like, we need to go to the emergency room right now. Like I'm getting more numbness in my hand and I can't handle the pain. Like I can hardly breathe. It's so bad. So he took me to the emergency room and I got in and they checked me in and immediately took me back because I was put on a stroke alert, a level 1 stroke alert because I was losing sensation in the left side of my body here and, even up through like my rib cage and stuff. And so I got taken back very quickly. I was all alone at the time because my husband had to come back and be with the kids. And so they did all sorts of tests where you smile, you're always smiling, right? And squeezing hands and pushing and pulling with arms and legs just to make sure that everything is right. So we get through all the stroke tests and they do some cardiology workup too. So I'm hooked up to all these EKGs and then they start an IV right away. Everybody was super, super nice. I was told I couldn't have any medication until they figured out what was going on, which was fine. I had asked very politely. And during this whole time, I was in such excruciating pain that I couldn't hardly sit still. So it was really hard to sit still to have somebody examine me. And so instead of just being a jerk about it and yelling and shouting at people, I would just tell people, look, I am in a lot of pain. This is the only position I can be in right now. I really want to make eye contact with you. It feels weird not making eye contact with you, but I can hardly breathe right now. And everybody was super understanding. And I think just prefacing my story with that really, really, really helped in terms of the care that I got because it showed that I had respect for the caregivers and that I understood people were trying to help me even if they couldn't get pain meds on board right away. So they sent me for CAT scan. It might have been 2 CAT scans or 2 MRIs and a CAT scan. I don't remember exactly which one was which because I was getting pretty out of it because again, pain will do that to you. I've always known that I've had a small disc herniation between discs C5 or between vertebrae C5 and C6. Okay, a disc herniation is when this is a vertebrae, this is a vertebrae, this is your disc. Okay, so as you're walking and moving along, see, it's kind of like nice absorption there. Yay, everybody's happy, right? And then one night you go to bed and you don't realize that maybe you have a tear in the annulus, and the annulus is the part around the edge, and it's supposed to be like super tight knit fibers that nothing can get out of. But every now and then, we just randomly have these tears, and then we get little leaks like this in the disc material that's in the center of here. And when that happens, sometimes it's a problem, sometimes it's not. But if you're like me, you're sleeping, you're doing whatever nice and peacefully, and all of a sudden, oops, that didn't work so good. But see, that's smushed out, right? It's all smushed out like that. And then you move again and it goes, and all this crap right here, it's all going into your spinal canal and it's pressing on your spinal cord like this. And it's creating an intense amount of pain. And the only way to fix it is for the surgeon to get in there and go, bye-bye, bye-bye disc. You know, he doesn't exactly take off the other vertebrae. They open it up like this. And like, bye-bye disc. And then they put a spacer in between here. They fill it with some bone material and some other stuff to help you grow your bone quicker. And then they put a plate here and they screw it in here and they screw it in here. So the whole thing is, I don't know if I can balance all this like this. And they plate it and that's fusion for you right there. So that is never going to move again. I had a very seriously herniated disc in my neck, and that was pushing on my spinal cord, and that's why everything was going numb. And so we were really worried about nerve damage at that point. So once they figured out what was going on, they gave me some pain meds, and they kept giving me more pain meds, and nothing was touching the pain. It was insane. So finally, the spinal surgeon came in, and he had a chat with me, and he explained that the C6, C7 intervertebral disc had completely blown out and required emergency surgery. And of course, in that moment, I'd been in the hospital for so long at that point that I was actually feeling a little panicky. I think one of the medications that they gave me a little bit of like suppressed panic attack, and I just wanted to go home. And so by the time the surgeon came in, he's like, you need to have emergency surgery. And all I'm hearing is, you know, disc issue. And then my brain's processing it as, well, I have disc issues in my lower back. I can deal with this. Just send me home on some steroids. It'll be fine. Yeah, it'll be fine. And so that's exactly what stupid drugged up me asked to do, is to get sent home on steroids. And of course, by the time I was released from the hospital Friday night, the pharmacy was closed that we usually go to. And so I had to wait till Saturday to get the steroids. So Friday night was awful. I was already regretting my decision not to stay and get this taken care of. And then by the time Saturday came around, I was like, I don't know what to do. So we called the surgeon's office and they're like, well, we can't call the on-call out and ask him any questions for you because you're not technically a patient here. You have to follow up with the doctor in our clinic before we can call the on-call. So, you know, I'm thinking really slowly. I'm just miserable. I'm throwing everything I have at my system and it's just not, you know, in following the directions, but it's not taking away the pain and I'm in agony. So by Sunday morning comes around and I'm climbing the walls still. And I told my husband, I was like, we've got to go back to the emergency room because they can call the neurosurgeon and get this taken care of. And so we did. We went back to the emergency room. By the time I went in on Sunday, I was numb all the way up through my forearm here. It was really, really bad. And I had weakness. I couldn't like push anything with this arm. I had no strength whatsoever. So it was getting very, very scary. We went back to the emergency room and promptly explained exactly what had happened. They saw me very quickly. And the ER doctor was so kind because I was expecting them to be like, well, why did you leave on Friday? That was pretty stupid. But they were not like that at all. He said he would call the neurosurgeon and we would get everything scheduled. And within about an hour, they had contacted a neurosurgeon. Neurosurgeon had scheduled surgery. I was under the knife. I woke up from surgery in recovery with, you know, this thing on, and they said that my only job in recovery was going to be just following nurses and doctors' instructions to like squeeze hands, push, pull, all of that stuff. I woke up with a very, very sore throat because not only do they intubate when they do the cervical spine procedure, they go in through the front, not the back of your spine. So when they go in through the front, they have to move your trachea and your esophagus, so your windpipe and your food pipe, out of the way so they can get in and do what they need to do. And of course, this creates a lot of inflammation in there. And not only that, but you've got the tube down your throat, which is also irritating no matter what surgery you're coming out of. Ice chips are really great. And I always ask for broth as soon as I'm able to start, taking ice chips down and whatnot, because broth really is soothing. It's warm and it's got a little protein in it. Kind of brings you out of the anesthesia better than something like apple juice or orange juice, at least in my experience. It's also up to you as a patient to advocate for yourself during recovery. And so the nurses told me going in, if you feel even the slightest bit of nausea, tell us, because we can give you some medication to eliminate the nausea so you're not throwing up, because the last thing you want to do after spine surgery is throw up. Of course, that's the last thing I want to do after any surgery. I've been there, I've done that. It sucks. So it was really wonderful because I was like, I think I'm starting to feel a little queasy, but I'm not all the way there yet. And I just mentioned that and boom, they gave me some Zofran, which is ondansetron for those of you who don't know the generic. So that was wonderful. And so I came through, I felt like I smooth sailed through recovery. When I woke up, I did not have any pain at all in my neck. It was all just my throat. And that was it. And granted, I was on morphine and they had some other stuff running through my system. I'm not even sure what it was, but I woke up, I did have a drain. They put a drain tube in here and there's a little bag that expands. It's actually pretty cool to pull out some of the inflammation. And it's neat because in the tube, you can see the different components of blood because they separate. It's really, really cool. So I think that really helped with the recovery. I was allowed to go home the same day. However, I opted to stay a second day. And here's why. If I go home today, they're going to pull the IV out and I'm not going to know how I respond to any of those pain meds that they're giving to me. So I was like, well, that's going to suck. And they're also going to pull the drain, which is less time for all of the inflammation to be draining out into this, bucket of goop. So, or this ball of goop, whatever it was, container of goop. So I decided I'm going to take the extra day. It was late in the afternoon anyway, by the time I would have been ready to go home. Overnight and the following day, we experimented with different medication. They gave me tramadol because I can't handle oxycodone, OxyContin, or any of those very well. And then we experimented with the methylcarbamol, which is the muscle relaxer. And so it was good to know that pain management wasn't going to be an issue when I got home. It was really great because if I'd left the hospital the day of, only 60 milliliters or 60 cc's of fluid would have been pulled out of my neck. But by the second day, that had doubled. So can you imagine all that inflammation back there would have just been intense. When I came home, I felt great. I was tired, but the pain was under control. I had some muscle tension and I had a little bit of burning from residual nerve pain down through the back of my head and my arm, but it was so much better than it was when I went in. It was more on the discomfort level, which was amazing to me. I was so happy. Now that I've taken you from my journey to the emergency room, through surgery and into recovery, I thought I'd do a second episode on all of the things that you need to know once you get home from the hospital, which is a lot. So definitely stay tuned for part 2 of this episode. And until then, I am Amy Giaquinto. I am Mama Fix It. If you like my videos, please like and subscribe and click on the links below in the description and go visit my website at www.amygiaquinto.com. Also, check out my cool merchandise. See, I'm even wearing my I Love Mama Fix It shirt. I love it. It's so cozy. It's such a nice sweatshirt. It keeps me nice and warm this winter, especially when I'm working in a cold place. So go check it out. Thank you so much for all of your support. I look forward to hearing your stories. If you have a story, please put it in the comments below. I will talk to you later. Bye! Just kidding. Oh my gosh, there's jelly on the GoPro. Ew.